Hello and welcome to our recording on academic reading and writing in the health sector for the health T level. Firstly, I would just like to start with a disclaimer. All information provided is correct as of recording of April 23 and may not reflect future changes to guidance documents. Please always review the most up-to-date guidance. Today, you are joined by myself, Tracy Hutchison, and Marina Gardazevic, and we are the Provider Development Officers with NCFE. And our role is to support you in CPD through workshops, face-to-face events, and bite-sized recordings such as this. My background is from HE, so teaching in HE and teaching health and social care, and I've brought those teaching strategies and experience with me and looked at how to explore and adapt that to the T levels for our providers.
And hello everyone, I'm Marina and I am the other part Tracy. Come from a science background, so I have a PhD in science with a medical research focus and a lot of experience teaching like maths and science, those really difficult topics, and I like to bring that to our support when we're delivering the T level. Going through the aims and objectives of this bite-sized recording. So our goal is to support you in developing the academic skills in your students that they need in order to succeed and excel in their chosen discipline. But by the end of this recording, we're hoping you'll be able to evaluate the academic skills required for the higher level study, outline strategies to support the students' academic skills, their communication skills, their thinking skills, and analyse the reading, writing, speaking and listening skills required for maximum success in the specialist area. So for this, in the health sector, we're going to start with Mo. Mo is a T-level student in health. He wants to do adult nursing at university and has aspirations to become a nurse. But where is Mo now? He's just starting the T-level. He has some exam skills, but limited in critical thinking. His experience there is exam skills are limited to his GCSEs. And he has limited or no engagement with employers or professional companies. So looking ahead, what skills does Mo need to develop over the next 2 years to succeed in his T-level? The highlighting here is professional behaviours and skills. That critical analysis, as we stated, that's something that's quite a step up from the GCSE, from that level 2 mindset. His problem-solving capabilities. He'll be given assessments in new formats, in new ways that he hasn't encountered as part of his GCSEs. This includes summation and synthesis of information that he was gathered across the 2 years, across various different types of lesson, both skills, behaviours, knowledge, bringing all that together. And also finally, different types of communication. So the communication with, for example, a patient, with a peer or with a superior. He'll encounter these on his placement, but also as part of his learning and as part of his assessment. So Mo said that he wants to go to uni to study adult nursing. So what does his university want from him? So here's an example for nursing degree from the University of Birmingham. They require experience in evidence-based practice. The course focuses on clinical skills, academic skills, digital skills are highlighted. Communication is highlighted as well as both verbal communication and excellent written communication skills. Then interestingly, capacity for independent study. And this is something that we harness and we develop in our students from those young age, but this is something that our students really struggle with. And again, as that step up from GCSE, they will have a lot of independent study and focus as part of the T-level. So in order to help Mo succeed, to help him move on, we wish to develop these strategies in Mo. So what strategies? So develop these skills in Mo. We're looking at strategies to develop the written and verbal communication, that independent learning, as we've highlighted, the problem solving, critical thinking, and again, that evidence-based research. So we'll start with academic skills. So written communication. This was a key area that students have struggled with previously in previous assessment series. So it really is an area to focus to support them with their T-level assessments as well as going into industry. So if we have continuous formative assessment in this area, we'll be able to prepare students for their assessments, but also support them going further. So helping them with how to structure written assessments. So this is linking, justifying, evaluating, including proofreading, checking for spelling and grammar. Also analysing their time. This is one that's challenging for students. So time management, how much do you dedicate to writing? How much do you dedicate to proofreading, particularly in like an assessment structure? Who is this written communication for? So keeping that professional manner. Are you talking to a patient? Does your language need to be less technical? Are you talking to a superior? Do you need to have that professional tone, etc.? A key area of focus also could be how to communicate in time constraints. These are things not just for assessment, we can think beyond in the professional world. We often don't get as much time. So let's say for presentations, to make them maybe look as pretty as we want. It's things such as not everything's about aesthetics, focusing on content. How do we do this in time constraints? And again, practicing and practicing that so that becomes embedded. Another highlight is references. This is an area that, again, students have struggled with in previous assessments. So using references to support their analyses, using them in their justifications, not just bunging them in there or doing them very generically, understanding where they get their information from. These are key written communication skills that we want to focus on in developing and supporting Mo. Now, on the other side, we have verbal communication. So these key throughout the ESP tasks, and again, has been highlighted as an area sometimes students have struggled with. As well as developing these verbal academic skills, we also want to focus on tracking our student progress through formative assessments. A good way to do this is via role plays. So how do professionals introduce themselves? How do they introduce themselves to patients? How do they introduce themselves to peers, to superiors? This is a key area that's also been misunderstood in the standardized patient role play for the ESP, thing that students have struggled with. But we don't want to just think in the boundaries of the ESP. This goes beyond just having mocks. So mocks are very valuable, but also we can go around this. So you could ask students to present an area of the core content, for example, aimed at different audiences. This could include not just audiences they may necessarily encounter, like a patient or a supervisor, but for example, how would you present some areas of the core content to a child or to a completely lay audience member? So understanding, getting them to really break down these components and checking their understanding if they can explain it to that level. You could also incorporate mini group discussions, observe how students communicate with one another. And then we can develop that even further, getting them to reflect on their own and give peer feedback on others' communication skills. Several things that we can develop and support in improving the verbal communication of Mo.
So how do we make Mo an independent learner? How do we get our students to be that independent learner that was highlighted as a key area for Birmingham universities? So a really key area is developing metacognitive skills. So STEM learning actually have some really good resources that explores this. So to sort of develop your own CPD and the understanding of metacognition. So in simple terms, this is the ability of a student to monitor, direct and review their own learning. This can be done through exam wrappers, so really understanding how the student is doing, what they've done well, how they've done it well, so going beyond the grade, identifying on individual areas of strengths and weaknesses, reflecting on even the adequacy of their preparation time, the appropriateness of their study strategies, even their independent learning strategies, and seeing any recurring patterns. So, do they easily get distracted in some environments? Do they work better in other environment. So they're in the library, in their bedroom, at college. So having a real reflection on what works well for them. Next is let's look at how we can make Mo a critical thinker. So a really key area to explore critical thinking is problem-based learning. So research has shown that learners who engage at those higher levels of Bloom's taxonomy then have usable knowledge to solve those real world problems. So real world problems in the case of Mo, exploring problems and care concerns for patients. It's like about looking at that real world application and in specific, those higher order thinking skills of evaluation, creating, problem solving. Group activities such as discussions, peer tutoring, cooperative learning has shown as an effective way to develop HOTS. And research has shown that this correlation continues between problem-based learning specifically and higher order thinking skills. So let's have a little look at the process of problem-based learning. So first you start with assigning a role to students that are in groups. So you have a group leader, timekeeper, note taker. You probably for your first groups, you'll start with those that are strongest as a group leader with a view of changing those roles around in future to improve those communication skills that Marina mentioned earlier. You then present a problem as stimulus material to the students. So adapt a case study from the sample assessment material. So using those sort of sample assessment materials, clinical stimuli to support that problem-based learning. Students identify what the key support problem is. So is there support needed, what the standard operating procedure is. They would mind map those ideas together. So what knowledge do they already have that can apply here? We would then send them that independent study to review this further and then come back together for a second meeting. This moves us on to the next stage, where in the second meeting, they then whittle down what the key problem is and the key solution is now, because they've now collated their evidence. Now they're going to whittle that down and really focus the solution. They would then present the solution, which can either be done independently or in groups through a formative assessment task. So this could be a presentation, an essay, a report, could align it with the synoptic assessment sort of format. And you would finally finish with a peer discussion, feedback, and reflection. In this way, the students are really expanding on that metacognition, the understanding of what they've done well and what they need to continue to improve on and what they would do next time to improve the process. So now we're going to explore how do we make an evidence-based researcher in our students. Okay, so evidence-based evaluations and conclusions are a really important step in reaching those higher order thinking skills. And it is a really fundamental key aspect that the students need to really continue to develop. And it was highlighted in our last two series on the Chief Examiner's report, being able to have effective evidence-based analysis and conclusions. Now, a really good way to sort of expand that skill is through evidence-based practice, which University of Birmingham highlighted as a key thing that they would want from their students, that the key area that they develop, and it's a key area of medicine and nursing to continue to do throughout universities and their careers. So evidence-based practice is a very common strategy, and it is this synergy between using clinical experience, so for our students that would be placement sim sessions, and taking into account patient values, needs, and really good, strong research evidence. Is this synergy across the three? So just exploring the process of EBP a little bit further. So it's a 5-step process. One is ask. So this first step is evidence-based practice to define the clinical question. We then have access. So once the students have a well-formulated clinical questions, they need to start searching the literature. They then need to appraise. So once they have located some relevant literature, they will need to critically appraise the evidence. So there are many different types of study designs which would affect how they would appraise the individual studies and thus the weight they give each study. This is commonly represented in what is known as the level of evidence hierarchy. They then apply key elements of evidence-based practice mentioned previously, so that best research evidence, clinical expertise, patient values and circumstances. And when applying the studies they have found in practice, it is important to do so in the context of the other two elements. And finally, audit. So once students have implemented the evidence-based practice, they need to audit and evaluate to see if it's effective. So what are the conditions of evidence-based practice? It must happen in a clinical setting, and because this will likely occur for your students in their sim sessions. So yes, there'll be some that'll be in placement, but the most consistent setting for the students will be in your simulated sessions. But the students can also use their diary or their logs from their placements as well to draw on that clinical experience. It needs to be over a long period of time, so that longitudinal, so that multiple exposure. It needs to be active and online, so presented in lots of different ways, so both engaged in classroom but independent as well through that online flipped learning. And at the beginning of every scenario session, sort of before that 5-step process, students need to recognise what they don't know and then reflect on this continuously. So let's explore an example. So our image on the right here is an example, right, gives more details of how the EPP can be used in a little bit more detail. So drawing on that information about patient preference values, evidence for research, using assessment of patient history. So just drawing on that evidence-based process in a bit more detail. Where the image on the left sort of contextualizes this a little bit further from our student perspective, so our T-level student perspective. So a clinical experience placements with skill session knowledge, that's the clinical experience of our students. Our key question that we're drawing for the students here is, what can you do to support the care of patient X with bed ulcers? The evidence that we will use for the students is the healthcare plan. The question that you would ask them is, what evidence can you find to support the care or the outcomes of that patient? And they really should be looking at that case studies, those medical charts. So you would probably give them the stimulus similar to the sample assessment materials for the synoptic assessment, where you're giving them the brief, you're giving them stimulus through the healthcare plan, you might give them a previous discharge charts, medical chart, and really looking at the care of that patient as a whole, and then drawing on evidence and their experiences to then find the best support solution for that patient.
So 10 years later, after all this support we've invested in Mo is now an adult nurse. He works for the NHS, and here are the skills he uses in his day-to-day. Again, we have that written and verbal communication. So as per the job description for a Band 5 nurse for the NHS, nurses have competent use of IT, ensuring that all documentation and record keeping is accurate, legible, and completed in a timely manner. So bringing in those skills Mo has developed earlier from doing written communication under time constraints and appropriate professionalism with their communication. Then verbal communication, so effective and honest communication with patients, relatives, and carers, taking into consideration the level of understanding, culture, and background. So here we have is presenting to different audiences. For example, carers may be more familiar with terminology than, let's say, patients or relatives. And bringing that in, Mo's very, very effective at that now. As well as effective communication with multi-professional, multi-agency teams. So bringing in this communication with different audiences, and Mo's now very effective at that. And then looking at his professional behaviours and skills. So a key element of being a nurse for the NHS is prioritising, organising and delivering aspects of patient care. effectively manage changing priorities, time management, those demands, meeting clinical needs and demands with existing resources. Now, he see that bit again, that problem solving. It's a good thing that was developed in Mo during his time in the T-level. He now has that his own initiative, so he's aware of his capacities and he has that kind of autonomy and confidence. He can problem solve and manage issues as they arise. Again, that proactive nature that comes from that confidence of knowing what he does know and knowing what he doesn't know. And then focusing on the critical skills, evaluative skills, and as Tracy mentioned, evidence-based research. There's another area that's highlighted. Mo can actively engage in research activity within the clinical area so that he can remain up to date with developments and therefore implement evidence-based practice. But additionally, in this level, being a nurse, Mo now participates in research and audit projects so we can implement the findings to improve patient care. So now Mo has an active role in that research, thus enhancing the research base and contributing to the overall evidence-based research practice. He's got that critical thinking, performing tasks which require critical thought, again, problem solving, implement and evaluate planned care using a holistic and evidence-based approach, and being aware of effective and efficient use of resources. So whilst we can see this journey for Mo, it's incredibly helpful for our students in the present day to see how their T-level supports them in achieving their career and in succeeding in their career. So we can see the mirroring between these skills of, as we said, problem solving, critical thinking, written and verbal communication, digital skills, and they can see kind of how that will take them through from the T-level. Thank you very much for watching from Tracy and myself.
Thank you.